most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about top 3 signs you have an ACL tear. And these are tests you can do at home. This is actually an updated video. We did it before. We're going to add a few more things.
Yeah, it's updated. It's wonderful. Let's carry on.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, by God, you're going to want to go to bobandbrad.com because we're doing a huge giveaway. We're giving away a Sleepovation mattress. Brad, you got the sign for that one too?
Oh, yes.
Sleepovation mattress, 700 tiny mattresses in one. Very, very comfortable. If you're having pain at night, that's the mattress for you. You are also giving away a couple pillows. Sam, I'm going to grab you the pillow from your head. And this is actually a cross-section of one. It's actually got springs inside the pillow. Very comfortable. Individual little squares of foam that is proprietary.
Oh, wow.
It's their own type of mix. Go to bobandbrad.com, go to the giveaway section, or go to Facebook. It'll be pinned to the top of the page, the contest that is. Go to Twitter or Instagram if you want a 60-second version of our program.
There you go. ACL. ACL tear. What does ACL?
Anterior cruciate ligament.
Right. And we're going to explain why it's called that in just a second. But first, we're going to look at the knee itself. Now, this is just the model of the knee. If this was my knee and I took the skin off and a lot of the soft tissue.
It would be that knee.
Oh, yeah. You're right. It is the right knee. Good call, Bob.
Yeah.
But if we take the muscle off the bottom here, we got some quadricep muscle here. And here is the kneecap, which is part of the tendon of the quadriceps, actually.
Yep.
And we're going to lift the kneecap.
The patellar tendon.
Yeah, infrapatellar tendon. And here we go. We're going to get a close-up so you can see. This is kind of a hard ligament to describe where it is, but it's in the knee. We're going to open the knee up. This is what happens when you bend your knee.
Can you be to hold it or you got it?
Nope, I got it. The blue, now your ligament isn't blue in real life.
Right.
We did it so you could see it. It is white color, but actually goes in, it starts in the tibia and it crosses over to the femur, okay?
Yep.
And then there's a PCL and that's the cruciate part. They actually make a crisscross.
Yeah, they make a cross. I think cruciate means cross.
Right.
Yeah.
And it's hard to see that part on here, but that's the location. Now we're going to show you what its job is.
What its job is to hold the knee in place.
Exactly.
Right.
Wait, Bob. Wait, before we go any farther, I've got to think about this. Okay.
You've thought about it.
Nope. Actually, we're going to not show what it does yet, but we're going to get to that.
Okay.
Because 3 signs. One of the first things we're going to do is what happens if you injure your knee. Number 1, audible pop.
Yeah, if you injure your ACL.
Thank
quite
you.
Often,
right.
Especially if you tear it.
Right. I thought you were going to carry
on.
No. Also, typically a lot of pain associated with an ACL tear. When the AC ligament tears, there can be some internal bleeding. That bleeding will come out, and you'll have that ecchymosis or that deep color red purple bruising around the knee. It's after the acute phase, and the swelling goes down a few days later, a week later, you start walking around on it. It feels unstable.
Yeah.
It just doesn't feel, it may clunk a little bit.
It's funny, I'm old enough now that I had two friends with ACL tears and they didn't have them repaired.
Sure.
And both of them have knee replacements now because, if the knee is not stable, it's going to grind around and it's going to grind down the cartilage.
And there you go. You got a knee replacement. Yeah. So you can live without an ACL, and it's not the end of the world. You can still function.
Your knee is unstable.
Right.
And
Exactly.
It's going to wear down quicker.
Which leads us to the next point. What kind of people typically have an ACL tear? So I did a little research on this, and sure enough, we're going to share it with you. And this kind of will help give you an indication whether yours is tear or give you what the odds are.
Sure.
First of all, the knee is the second most injured part of the body, second to
the ankle.
That ankle.
Yeah.
Right.
Those ankle sprains are so common.
Yeah. And this is a general statement, but if you go to ACL tears, Majority are with sporting activities.
Sure.
Okay. By the way, 76.6. Now, this is a study done over 5 years with
Sure.
athletic people. 76.6% had surgery from the, as a result of the tear. As far as how they happen,
Sure.
player to player contact, 42.8%, 37.9% injured without contact, which happens a lot of
It
times
does.
with basketball,
Right.
particularly with females, which we're going to get up to
I've
next.
seen a number of them on site when it happened.
Yep, exactly. So have I. Both of our daughters played basketball.
Right. So that came.
Exactly. ACL tears with girls in sports. The two biggest sports, basketball, which we already mentioned, and soccer.
Yeah.
Actually, with boys, it's football and soccer. And actually, boys have a low incident of ACLs playing basketball, which I thought was very interesting.
That is interesting.
Yes. We're not going to get into the reason why girls have it more, but there's an anatomical.
The shape of the bone.
Yep, exactly. So that may give you an indication if you're active, you're a female playing basketball and it happened to basketball, chances are a little higher.
Yeah.
Now, the next thing we're going to show you is 2 tests that doctors or therapists will do. You can do these at home with another person, but you're going to have to pay close attention, and because there's really no real harm that can happen here.
Right.
And it may or may not be accurate for you to do it.
You need a little bit of skill set here, but it's certainly it's worth a try.
Yeah, you can certainly do it. And these are what the doctors and therapists are going to do.
Exactly.
Then you're going to know exactly why they're doing it.
At least you'll have some knowledge going into it.
Exactly, Bob. Now, what I do want, we're going to use Sam.
Sam.
We're going to use Sam here so we can show how this works. Now, these tests, the person with the injured knees laying down on their back, nice to put a pillow under their head. And the first one is called the Lachman's test. Now, I don't know with you, Bob, when I was in school a couple decades ago or whatever, this was known as the gold standard test for the ACL.
Interesting.
In other words, it's used a lot and it's pretty well depended on.
Sure.
Obviously, now it's, MRI is going to be the confirming thing. But as far as manual tests, this is still used a lot. So the knee is like this. Person's laying down. The other leg can be straight. It doesn't matter on this test. Now, what that ACL does, it prevents the tibia from translating or moving forward like this.
Right.
Okay, that's its job. Okay, so what we're going to do here, typically I do this test like this on a patient, but you won't be able to see what I'm doing. So the hand placement's the same. I'm just going to do it from the other side. Okay, one hand supports the femur, wraps right around below the kneecap. You get a good hold of it there. Typically, my knee is going to be underneath right here.
You'll show it on me, right, Ben?
Yep, I'm going to show it on Bob. And then we're just going to simply pull out. And you'll feel translation. If it's a torn ACL, first you do it on the good leg.
Right, that's what I was going to say.
Exactly.
Everybody always does it on the non-involved leg first, and you get a sense of how much motion they have.
Actually, this works pretty good with Sam. Our other skeleton didn't have this, but you can feel that translation.
Yeah, it's actually got the ligaments in there.
Yeah, a healthy knee I've had a healthy knee translate quite a bit.
Right.
So you check the good one, see how that moves, and then if you go to the other one, and like my old instructor would say, if it opens up like a barn door, you know there's a problem. But yeah, you'll feel significantly more movement.
Person's got to be very relaxed. This isn't something you can often do right after the injury because there's so much swelling and so much pain. Yeah, they don't even want you to move it.
Exactly.
So it's one of those things that things have to calm down a little bit before you can do the test.
Oops. Now the second one is called the anterior drawer test. I'm actually going to do it on his left knee. I have the patient like this, and I tell the patient I'm going to sit gently on your foot.
That's exactly right.
And what that does is that stabilizes the foot so we can perform the test. And then I grab underneath the knee. I put my thumbs right on the knee joint, and then I pull out this way, assessing how the ACL is, the integrity of the ACL.
Yeah, again, it's basically the same movement as the Lachman's, but it's just a different way of a
different angle, a little more bend on the knee.
A little more bend.
And the foot is locked in, the hip is
Secured.
locked in, so
Yeah.
it's a little bit different.
Yeah.
It's nice to do both of them. Shall I show it
Sure.
on the real patient?
Yep.
Well, Bob's not really a real patient,
That
but
would be me.
here should we
Let's
just lay him down?
Lie him down.
Lie? Yeah, there you go.
He's got his elbow
Okay.
dislocated there. Which knee do you want to show it on, Brad?
I'm going to do, we'll go to Lockman's. I'm going to do it
Okay.
on here. Now, like I mentioned before, this is how I do it. I like to put my knee.
Oh, you got cold hands.
Oh, don't
Oh
worry
my
about it.
God.
Toughen up, toughen up. I'm not like that to my patients, but to Bob, it doesn't matter. Okay, getting back to serious. We just go like this, okay, and he relaxes. And it's not that cold.
They are that cold.
Now, I'm grabbing here and stabilizing above the kneecap, and then I go down. It's below the knee joint, the joint line, which it happens to be right at the base of the patella. We're going to go down there, and I'm going to come around here, and I'm going to pull up, and then I can go down. So I have a hold of that tibia, and we just check like that. Yours is pretty tight, Bob.
Yeah, I got a good look at it.
Yep, you do. I'm not going to do the other one. Again, I would do the good knee first and then do the sore knee second.
Sure.
And
Yep.
then compare and contrast. Now, the other one, I think I will do this like because it's easier for them to see.
See, sure.
Yep. So I call this a hook line position. I'm going to gently sit on the foot. Okay. My hands are going to go underneath the knee, right in the crux of the knee, if you will. And my thumbs, again, are going to be right here at the joint line, right below the kneecap. And they're going to palpate or feel for movement of that tibia. Okay, I'm going to pull this way. Now, it's important, critically important, that the patient's relaxed.
Yep.
If their hamstrings tighten up, you'll get an inaccurate reading.
Yep.
So relax. There you go, Bob. Good job. And I say that to my real patients. But Bob, I don't care so much about. But actually, I can feel that translation very clearly with my thumbs right now. The healthy knee first, and then go over to the injured knee. And you will feel a difference with your thumbs, as well as oftentimes you'll feel like it clunk and back and forth. Again, usually you can do that without pain. It depends on how long after the injury it is. If it's all swollen up yet,
Right.
it's probably too early.
Yeah.
So you got to let things settle down, cold pack, ibuprofen, whatever it's going to take to get that swelling down. You may be up to a week later.
Again, at the least you're going to know what's going on when the doctor's checking you. If you don't feel
Exactly.
comfortable in doing this, but,
You'll know exactly what they're doing, and then you can communicate with them a little more
but
effectively.
as Brad said, you're not going to hurt the knee. You're not going to stretch out that ligament or hurt it by doing this test.
Right.
I mean,
If it's tore, it's tore, and if it's not,
It's
you're not.
Yeah, you can't put enough
Right.
stress on there to hurt it.
Again, all these should be pain free.
Yeah.
They should not create pain. If so, don't do it yourself.
And remember, Brad and I can fix just about anything.
Oh, you're right, Bob. Except for.
A broken heart.
But we are working on it. As a matter of fact, I stayed up last night doing overtime on it, but I got
No, we
nowhere.
didn't.
No, I did
Oh,
too.
thanks for watching.